For all intents and purposes, we believe that what has actually happened has focused the profession in a way that the profession has never been focused or at one ever before. We think we now have opportunities to virtually re-engineer the way that community pharmacy is practiced, taking on board some of the lessons that we've learned from the Elizabeth Lee case. Clearly we're going to seek to decriminalise dispensing errors, and there are a number of technical strategies and plans in place already to do that. We're also going to talk to the Ministry of Justice to make sure that the police aren't involved in haranguing pharmacists after gross negligence manslaughter charges have been exhausted. And we also want to talk to the Home Office to give guidance to judges on sentencing pharmacists. We believe that the legal change will come simply because we've already been told by the Department of Health that the door is open and that they are very sensitive to the concerns that we have. However, we feel that it would be awful if we missed out on the opportunity that the situation now gives us. And what we really want to see is virtually a re-engineering of the way that pharmacy, and in particular community pharmacy, is delivered. We really want there to be a brand new focus on the role of the pharmacist doing that third check, the clinical check. Now this will involve the pharmacist in far more than just making sure that the medicine is accurate and that the number of tablets are as they should be. It will almost certainly need to be that the pharmacist will be talking directly to the public, examining exactly the medications that they have on their prescriptions and putting in the clinical input. We know that today that's virtually impossible because resources are so poor in community pharmacy. There isn't the time, there isn't the resource, and there isn't the support staff.
I think it's very important that the whole profession unites and everybody gets behind this, because I think we've got an opportunity now to unleash ourselves from what is perhaps unfair restrictions on our practice, and that we can really do what the government wants us to do and what our patients want us to do.
I qualified in January 1957, so I've been on the register a few years, and I must have made more mistakes than I've had hot dinners. And if everyone believes the class is a criminal prosecution, then I'd still be in jail. And I feel very strongly about criminalisation of errors, because we do the best job, as somebody said, that Mrs. Lee, the lady in question, was a very honest and conscientious pharmacist, and she was doing what she could.
I have written to my MP. I am also seeing a local MP quite soon, and I should be raising this subject. It's one of the most important things that's happened in pharmacy. I think the effect on patient safety is critical, because who now will want to report their errors? I think it's just absolutely wonderful, and I'm really pleased that this meeting is being held today.